Hello and welcome to Northampton General Hospital Radiotherapy Department. We are situated in Area N of a hospital site in the Luke Radiotherapy building. When you arrive, please report to the Luke Radiotherapy reception. One of our radiotherapy assistants, who will be in a white uniform, will book you in and ask you to take a seat. If you are being treated on TR1, you will be asked to make your way to the building through the main oncology department and covered walkway, where you will be asked to check in the waiting area. We have several different types of treatment unit that are used within our department. Most patients are treated on our Linear Accelerators. If you are having treatment on our Golme unit or are due to have brachytherapy, please see our other videos about these treatments. On the first day of your treatment, a radiographer will collect you from the waiting room. You will be taken into a clinic room where the radiographer will ask you for your name, address and date of birth. If you are a lady of childbearing age, we will also need to make sure you are not pregnant. The radiographer will then explain what will happen during your treatment and answer any questions you may have, and make sure that you are ready to go ahead with your treatment. If you need to change for your treatment, you will be shown where the changing rooms are. When you are changed, you will be asked to take a seat by the treatment room until the radiographers have a room ready for you. Please do not enter the room before you are asked to do so. When the radiographers are ready, they will ask you to come into the room and will once again ask your name, address and date of birth. Treating you will be 2 radiographers. There may also be a student radiographer. If you do not wish a student to be present for your treatment, please inform the treatment staff. Once in the room, you will be asked to lie on the bed, in the same position that you were in your planning scan. You will need to have the area that is being treated uncovered, but the radiographers will cover you up as much as they can. The radiographers will look for the marks that were made at your CT scan and may use a washable pen to draw on your skin. You may hear the radiographers call out several numbers to each other. These are once again to ensure you are in the correct position for treatment. The room lights will be dimmed so that the radiographers can use the green lights to line you up in the correct position. They will work together to adjust your position as needed. It is important you do not try to help, as only very small movements are needed. When you are in exactly the position for treatment, it is important that you remain still and breathe away normally. The machine will be moved around you, and the radiographers will check to make sure the treatment machine will not touch you. When all the checks are finished, the radiographers will let you know that they are going to leave the room, so your treatment can start. It's very important that you continue to lay still. The radiographers will be just outside in the control area, making further checks before they switch on the treatment machine. You may feel the bed move slightly. The bed is being operated by the radiographers from outside. You can be seen by the radiographers at all times from the cameras in the room. If you have any problems, please raise your hand at any time and the radiographers can stop the treatment. At times in your treatment routine, X-ray pictures are taken to make sure the treatment is as we expect it to be. Unfortunately, these will not tell us if the treatment is working. They are just used to make sure you're in the correct position. To take the images, a panel will be brought out from the machine. It may come close to you, but will not touch you. Radiotherapy is quick to give, with each beam taking less than a minute. It may be that the radiographers need to come into the room to make some small adjustments. It is important that you remain as still as possible. Radiotherapy does not hurt. You may hear the machine making a buzzing noise when it is giving the treatment, but there will be nothing to see. Radiotherapy will not make you radioactive, so there is no need to avoid children or pregnant ladies. Once the treatment is finished, the radiographers will enter the room, switch the lights back on and move the machine back to the starting position to let you get off the bed. Please do not sit up or get off the bed until you are asked to do so, as you may be high up in the air. The treatment delivery will be the same every day, so you will soon get into a routine. Appointments are usually between 10 and 15 minutes long. On treatment, you will be asked to attend a radiographer review clinic. The radiographers are always happy to talk about any side effects that you may have and are always willing to answer your questions. We also have a Macmillan information suite for any other questions you may have about your care. On your last day of treatment, you will be given a follow-up appointment to see your oncologist. If you need advice beforehand, the review radiographers are always happy to answer any questions you may have.